Hey everyone, welcome back to the Couples Therapist Couch. This is Shane Werkel, and today I'm speaking with Dr. Rebecca Jorgensen, leading emotionally focused therapist and trainer. Hey Becca, welcome to the show.
Hey, Shane, it's so nice to be with you.
Yeah, absolutely. It's nice to have you back. I should have looked at which episode it was. It's been quite a few years, I think, since I had you on. But why don't you tell us a little bit more about what you've had going on?
So something that's been new for me career-wise is I've been revisiting a lot of my early roots, I guess, And so I did open up a number of years ago now, a local clinic and training center that's called EFT counseling. And so I have students and interns and associates, right, working for me that I get to do hours that count for their licensure. And after many, many decades of working with mostly licensed professionals, that's been really fun. Also, I've kind of been revisiting early years of doing a lot of work publicly with sex and sex therapy. And so I've been kind of freshening up my toolbox with all of that by completing a sex therapy training and finishing up my hours to be certified as a sex therapist, because that seems to be a lot more in the atmosphere these days. Anyone can call themselves a sex therapist, but people are much more promoting their status, right, as sex therapists, as couple therapists that are also doing sex therapy.
Right.
Couple therapists have always been doing sex therapy. I think at least I always have.
Yeah.
But that's so much more in the environment these days. So that's also been really fun.
Yeah, that's a good question, actually. You've been an EFT therapist for a long time, trainer, teaching people how to do couples therapy. I mean, how does that sort of sex therapy training kind of come into it? Because like you said, a lot of us probably feel like we're having conversations with couples about their sexuality and what's going on with them sexually and things like that. What do you think about the importance of that, bringing that into the couples work?
It's really interesting because in the sex therapy work, they really talk about looking at cycles, what's happening, and know that in a couple relationship that safety is the basis of having desire and being able to perform sexually. So where we're working with what happens in like a pursue withdraw pattern and what happens in the nervous system, those things that would be doing naturally anyway. But when couples now present, and this has been in the EFT atmosphere, George Fowler and Lori Watson have been doing that, a podcast for a number of years, trying to help people prioritize that way of being, that romantic avenue of being safe with each other and developing security that way for a number of years. So I was a very, very early adopter of putting sex in the cycle, and Zoya was very early, and then it's been getting a lot of publication around that. So that all feels really very natural to me, and both go together. So because you've got to have some de-escalation and stabilization to have sex be fun and playful and feel secure, you have to develop that security. The same as to be flexible, as we have to have a more secure attachment to be flexible. So it really fits very well. And it helps some couples really want to talk about it. And I always have been bringing it up all along anyway. So in some ways, it's like, oh, here's this feels like a shiny object because I'm the student instead of the teacher. And then at the end of the course and the end of the training, I'm like, yeah, okay, that's right. I've been pretty grounded in this all along. It's all right, right?
Right. Good reminder and some new.
Yeah, and it's always fun to hear new perspective, new voices, and have that integration aspect of it, which is really important for ourselves. Yeah,
absolutely. And I know another thing we've talked about is you're doing a lot of intensives. I mean, that's pretty much the way you work these days.
That's right.
And can you talk about the helpfulness of having an intensive in order to create the safety and security that you're talking about?
Yes. So I've been doing intensives almost exclusively. I have one or two couples ongoing or one or two individuals in an ongoing way. But when I've been very, very busy pre-pandemic and I was traveling all around the world, there was no way to hold a caseload on a weekly basis. And early on, escalated couples, they don't do well they can't get momentum for change without some consistency, right? So I've been doing pretty much exclusively intensives for very early adopter, probably 18 or 19 years, right? So one of the early EFT summits on how to do one, how to do them, did research in my own practice on outcomes and following couples and that sort of thing. So what I think they're really helpful for, there's a couple things that I think they're helpful for. One is couples to get momentum. Like maybe they're very, very distressed and there's no really intention of like moving through to security in an intensive, like nobody's nervous system can remap that fast, right? But you can get them a very good felt sense of where they get stuck and have a kind of an understanding of their cycle and an ability to start to interrupt it. So there's some early momentum for highly distressed couples that can really augment their therapy. The other way I find intensives really helpful is couples who've been in therapy and feel like they're hit a stall or a stuck place, or maybe they're working with a couple therapist and it's not enough time to get them by the end of any one session in kind of a calmed place enough to go out the door and feel like things are kind of wrapped up in sort of a way, like maybe it takes them a long time to open up, or they come in so escalated that the therapist can't kind of get them calmed down enough and they leave in distress. They come in distress, leave in distress. So then an intensive is really helpful in those kind of situations. Either they're stuck in therapy or they're leaving therapy pretty discouraged because they're opened up and not feel like they're back reconnected with each other by the time they leave, and then they're without any skill or what to do in between time. So the weekly feels so long and hard. Those are really helpful ways. But then, I've certainly have couples and see a lot of couple therapists who can do so much on their own, but can't do the formal EFT change events like the withdrawal, re-engagement, pursuer softening on their own. So they come in pretty de-escalated and they just want an experience and to have those change events happen. That's more rare, but certainly fun when it happens.
Yeah, that's great. Do you see that calming of the nervous system as often or always even the first step in helping couples to sort of begin the process?
Well, you have to be able to create safety. Like we don't learn well, we don't develop new experiences. If as humans, if we're out of our window of tolerance, it's really hard to take any sort of new learning. And so being able to have therapy be a safe place is like Alliance 101, right? Like we have to be able to feel at least seen and heard by us, maybe not yet by their partner, and have enough safety that they can go, oh, this is what's happening, and be able to go, this is what's happening inside of me, and this is what's happening between us, and have that seen. So yeah, like that's step one of like, but we're not going to get anywhere if we can't create some safety.
Yeah. And like you said, I'm sure anybody who has worked with couples before has had that experience where if you only have 50 minutes, maybe the first time you've met with someone or one of the first times and things get escalated, it's really hard to feel like you can do anything. And,
Well, yeah, the intensity is so high and there can be a lot of contempt. There can be, so much hostility, and being able to get in there and calm that down when with couples, people we don't know yet, that can be very challenging. And if that happens repeatedly, like with some couples, well, we're people too. So we have a bad first experience. They have a bad first experience with us. We try to put ourselves back together. They come back in, they're still escalated again. And so, of course, that our own ability to be kind of grounded. So in EFT, we're the temporary attachment figure, and we're trying to help co-regulate two other nervous systems along with our own. That's important for creating safety and hard to do. And then so we can get really triggered by particular patterns, particular presentations, particular couples, even the best of us,
Yes.
Like I feel like I have a pretty solid nervous system at this point with whatever comes in the door. Doesn't mean that I don't get triggered like my own stuff or feel like, what do I do in any one moment? But I've learned how to do a lot of that in session to come back to myself, right?
No, that's great. And I think, I try to emphasize on the podcast all the time about the importance of therapists doing their own work, and I definitely think that makes us better therapists for the people we're working with. And but I appreciate what you're saying. No matter how experienced you are, you're still a human being. That's going to happen. And that's totally normal to sort of feel those triggers come up sometimes.
Yeah. And I think as we're learning to be couple therapists, it's such a different atmosphere in the room than with one person, right?
Yeah.
It's such alliance is not nearly as fragile. Like certainly with some of our traumatized clients, alliance is going to be fragile, but it's a different atmosphere and a different risks for our clients to come in together. It's very vulnerable. Like they have no idea, are you going to be on my side or my partner's side? Or are you going to actually see both of us? And they don't even know necessarily what to expect, right? So I think every new couple is a kind of a new challenge in that way. Meeting them, being able to feel secure in ourselves and meeting them, and then like finding out who they are, where they're going, which is part of the fun of it, actually.
Right. It's like solving a mystery.
It is, yeah.
And you used the word temporary attachment figure, I think it was. Can you talk about the challenge, especially of doing that for two people in the room at the same time?
Oh, yeah. That's very challenging because from the EFT frame, we are coming in really collaborative as humans, meeting humans. This is not from an old psychoanalytic kind of blank slate perspective. We're here actually trying to use our empathic presence to co-regulate them so they can feel seen and heard from us, that we know that calms the nervous system down to be seen and heard. So it is a challenge, especially when we're learning and our prefrontal cortex says, what are you going to do next, buddy? And I don't know what I'm going to do next yet because I'm still learning, if I'm in that learning space. And so having that kind of felt security or how are we going to handle that? Not having that in any one moment, like not knowing what to do as we're in a learning journey, I think is very, very challenging which is why couple therapy many people have talked about it being the hardest form of therapy, really, right? And it takes a lot of courage for, I just think people who want to be couple therapists, like so courageous and willing to learn and kind of get in the grit and be helpful. So we kind of need that mission, that courage, and some why, some meaningful why to help us be in that learning zone.
Just to speak to the client's experience for a moment, if someone's going in for individual therapy, it's still going to feel vulnerable and hard, and you're opening up about very personal things. But in some sense, you have control of the way that information is conveyed to the therapist.
That's so true. Nobody's going to say, that's not quite how it was.
Right. But when it's a couple, right, like there's still the same level of vulnerability, but then you have this unpredictable person who's your partner who's with you. And, a lot of times people they might be moving too fast with the story, or they might be saying things that feel like criticism. Their protective parts are coming up and saying like, no, that's not true. And it's like so much more difficult for the therapist to navigate. There's these two nervous systems interacting with each other, not just, listening to one person's story and creating safety for that individual.
It's so true. It's heavy. It can be really heavy. I know as I am supervising and training new couple therapists that sometimes they'll say things like, oh, wow, it was just so hard, or it's so heavy, or they feel the sympathetic nervous system reaction. And of course, we're holding it together in the room. And then afterwards, feel all this review and anxiety about it. And what did I do right? What did I do wrong? And it can take sometimes hours to settle down because we maybe not even know what hit us. I now have my own process for when that happens to me that I can go, okay, where did I feel that? Like, and I wasn't able to use it? Or where did I feel my danger signal go? Ding, ding, danger. And most of the time I know how to use it. But sometimes if I'm hitting some kind of, blind spot in my Johari window, some place that I haven't explored yet, or maybe there's something going on that I feel particularly vulnerable about, and it's not in my conscious awareness.
Absolutely. I'm thinking back to the idea of creating the safety for two people, or even being a temporary attachment figure. Can you say a little bit about how you would accomplish that?
Well, this image just came to my mind as you asked me again about it. This image came to like a mother or a father holding twins. You know how they have one in one arm and one in the other arm? And what if they're both hungry or fussy at the same time?
Right.
That's the image that came to my mind. Like,
Yeah.
as this temporary attachment figure. And you got two fussy babies, maybe one really mad and screaming and one like wet diaper, they need your attention, whatever.
Mhm.
And what do we do then when that's the case? Because when we have really distressed couples, that's their nervous system is saying, help me, I need support. I need attention too, right? And so the more dysregulation there is, the more there's a need to attend to both, right? So while I'm looking at this one, and my arms just kind of naturally come in like, oh, I want to be able to have them both in view, even if I'm attending to one at any one moment. Like, I want to try to soothe one, but not leave the other one alone too long. Mm-hmm. And so as that happens, as we're able to hold both, sometimes both, like, oh yeah, you're both really struggling, and then a little attention to one and a little attention to the other, that soothing starts to take place. Mm-hmm. But so that the image for me is that the more distress there is, the more we hold the unit, like the two, and that we have to quickly be with one and not to leave the other one alone too long, so we can continue to add to the soothing.
Yeah, I love that analogy. I think it makes sense. Hopefully with the couples we work with over time, and that could even be in the first half hour.
Yeah.
Over time, hopefully they're feeling, okay, my needs are going to be attended to as well.
Yes.
Right. And maybe we're going to focus on the other person a little bit, but I know that she's going to come back to me, and hopefully that's the feeling that both people get as the more you get into the work.
That's right. And that's a beautiful way you describe it, because that is attachment language, in the way that in secure attachment, we have reliability, right? Like accessibility, reliability. Like, I know you're going to come back. Maybe you're not here right now, but I can count that you're going to come back. So we become predictable and reliable. And that helps. That's what they don't have with their partner, is that predictability and reliability of accessibility. And so they can learn that very quickly from us in the way that we hold boundaries in the session, in the ways that we manage the session, that it's for the group, for the we, for them as the couple. And then making sure that we're paying attention to each one, and knowing, like, even when I'm working with you, you're in my mind, because you can see my eye contact, looking at you, I'm talking to you, but I'm nodding at the other partner. I may use thank you for waiting. I may say, I know it's different for you. So they know that I'm carrying them, I'm holding them, even when I'm working with their partner, and that I'm going to get back to them.
Yeah. I think such an important part of that as well is the idea of, how do I give someone empathy and compassion for their experience without getting sucked into the language of blame and criticism and judgment of the other person? Because I don't want that other partner to experience it as though I'm like believing the other person's story or the narrative they're creating, just because I'm validating their feeling experience. It's
really so important to learn how to validate one partner without invalidating the other one.
Right.
How do we hold both subjective realities as that person's truth from their perspective? That's actually their lived experience, when they have very different lived experiences, right? So it can be very challenging to learn how to validate without invalidating the other one. And then we can use supportive language in addition to that. So I'm really clear that when I'm talking to you and you've experienced your partner as being very, very critical, or you're criticizing your partner in front of me, which I think that's clear, especially if it's impact and intention are very different things.
That's right. Yes.
And so that's some language that has helped me to not invalidate one partner while I'm working with the other one. I'm collaborative, so I want to get the partner who's being critical, maybe being even emotionally abusive or gaslighting in some way, that I get a coherence with them about what do they describe that. how do they call it, right? I may have a label for it that's my own, and sometimes I will introduce that. But I also want to get from them, what do they call it when they are doing, and I may repeat what they say. When you just now said, my partner is blah, 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 blah. Well, how would you describe that? And they'll give me some words. Probably not. They're not going to say I'm being emotionally abusive, but they'll give me some words that then I can say and the reason you're doing that, I can link intention and call out. And while you do that, that has a really hard impact on you, partner. Mm-hmm. All right. So I can really amplify the impact of that and also not be losing my alliance with the one that you're seeing that acting, that kind of bad behavior, right? And then sometimes I will say, and sometimes partners will say, that's gaslighting, or that's this, or that's that, right?
Right.
Which is helpful when they do. And it also tells you something important, that it's probably less coercive control in the way of, when we think about interpersonal partner violence, it may be in a pattern, in a cycle way, but not what John Gottman would call cold violence. Not like I'm doing this on purpose to control and manipulate you, right? That's not the intention. The intention is like, I'm having an emotional moment and I'm blowing out on you and I'm calling you names because you hurt me and I want you to know what that feels like. But so it's important that some couples, it's important that we name that process in the room.
Yeah, that's great. And you said something earlier, like each person's experience is valid. Whatever they're trying to say is valid, right? But, I think it's important to check in with people about what are you hoping to get from this conversation?
Right, that's right.
If you're approaching it in this way, your partner is going on the defense. Do you feel like you're getting what you need from? Can I help you with how you're communicating that? Maybe so they feel more safe to lean in. Your feeling reality is completely valid, but maybe there's a different way of communicating what's going on for you.
Yeah, and what's blocking that communication, right? So if they're hurt and their protection comes up in this angry way that blocks them from communicating well, and that's often what couples come in for anyway, is to have improvement in communication.
Right.
That's really important. And the other thing is that we don't let it happen in the room. They describing it to us is different than doing it, right?
Yes.
So, if we're on the football field and we're the ref and there's a foul on the field, we stop the game. Mm-hmm. Right. We have to interrupt that process. So really, what we're talking about is when they're trying to communicate to us and describe to us, and then they get caught in their story, like they're rehearsing what the last fight was and what they did in the fight, and kind of a then and there experience by telling us, and the partner is rehearing it and it's re-injuring in that way, that they're not actually doing it in the moment. They're really trying to communicate with us what happened. So we can very much explore that, that impact then actually works against you, because that's not what your intention is. Yeah. You're trying to get through something. So you're trying to get through pain and hurt, and what you're sending is anger and contempt, right? That's not going to get through to your partner, that your partner has the ability to hurt your heart. That's you hurting your partner's heart.
Yeah.
And that doesn't open your partner up to help them know how they're hurting your heart, right? So, following that process is really important. You can hear me. Those are vulnerable spaces. So I want to make sure that I'm also honoring bringing their nervous system into some sort of safety while I'm confronting what they do, so that they can also be open enough to hear me and have some ownership around that.
Yeah, I can hear just in your voice this gentleness in the way that you would want to communicate that to people.
Yes.
It could very easily be taken as like you're blaming them for how they're communicating or something.
Yeah, we could be shaming them for blaming their partner.
Yes, right.
And then we lose them.
Yes. So it's definitely part of the craft of being a couples therapist to sort of be the referee and gently sort of help them see what's happening, making them feel bad as much as we can.
Yeah, absolutely. And at least that they can tell that our intention, and we can be explicit about our intention. Like, what I'm trying to do here is help these things slow down so we can have a different conversation.
Yeah.
So even if I'm not successful at implementing it, at least I try to be as transparent as I can about my intention. So I'm in the ball field. They keep me on the field. They don't fire me from being a harsh referee, right?
Yeah, and it's like the message. I want to help you get more of what you want. That's
the only reason I'm there with them.
Yeah,
right. Because I don't have any agenda for how their relationship needs to be or should look, or are they in it or out of it. Our working alliance and our task alliance that's a part of the alliance that's so critical, that we have a shared goal, right? That we're on task. And especially in EFT, because we have research that will say, it's not so much that you like me, it's great if you like me, and we have a good rapport, and that helps quite a bit. But I just think about going to a dentist, and I had this dentist where, you have to open up and be pretty vulnerable, and it's painful. It can be. Hopefully they give you good numbing. But I can have maybe a rough, a dentist or medical provider that has kind of a rough bedside manner. But I leave feeling better. And, they did what I hoped they would do for me and helped me get what I was hoping for. So that task alliance is so important to what we're doing. And so, that's our intention, and being there for them, and what we've agreed on is the goal is really important.
Say more about what you mean by task alliance. I mean, I understand as far as the clients feeling like we're on the same page about what we're trying to achieve here, and our therapist gets it, so that they feel like you said, it doesn't matter if you're their best friend or not, but they feel like we're all on the same page about what we're trying to achieve here.
Yes, absolutely. So we've got the overarching why they're there, and what, this is the way that we work, and is this gonna, we'll go forward. This is the goal that you have. You want to communicate better. You want a better sex life. You want to feel close again. You want to feel safe with each other, right? So then at any one moment, I have that. And if I have to interrupt them in the service of that task, of that goal, then I can say, this is what I'm trying to do here, is help us get to that place that you really want to get to. And in EFT, I can actually even use my task alliance for every step of the way. So there's these moments where we're going to interrupt, which we're talking about. But let's say I want to really know what's happening inside a person's heart or their nervous system, their fears, what's vulnerable. Because we know from the EFT research that it's these vulnerable conversations that connect us as humans, and certainly as partners, and that people are missing that in the dysregulation. They miss connection. They miss feeling on the same page. They miss being heard and understood. So any one moment, because I have a clinical roadmap for what's going to happen, not only across the course of therapy, but in each session. What's the process map, which we call the tango, the EFT tango. So from every move, from what's going on here, what's the present process, to, hey, partner, I want to work with you to understand a little bit more about what's happening inside for you when you feel like you're getting put down by your partner, or when you move into this place where you're putting down your partner. Would that be okay? Can we do that? So I can actually maintain task alliance every step of the way. Also, they can go, okay, yeah, all right, and become more vulnerable, and I can organize their experience and then invite them into sharing with their partner these enactments, which we know are kind of the juice of creating change, of having new corrective experiences, by saying, how would it be okay now? Could I invite you to turn? That'd be all right. So I can get and maintain that task alliance, just even as little consistent ways along the paths to keep it really collaborative. And so I stay really close to their experience. And partners, that be okay with you if I spend some time over here right now?
Yeah.
And then they get dysregulated over here, and I'm working here, and I'm like, oh yeah, I know. It's so hard to wait, isn't it? You want to give me that time, and it's hard. And then they're reminded, oh yeah, they did agree, and it's okay, right?
Any other thoughts?
It's the most rewarding thing ever, isn't it? I just I feel so passionate. It's so rewarding. And even the hardest of hardest cases, Like, it's amazing what partners will do to find each other, how much risk they'll take, how much moving into growth that they will do. Like, I just believe it so much how we're made for connection. And then I did want to say this earlier on. When people are really, really triggered, I think it always helps me to remember nobody likes it.
Mm-hmm.
The partner doesn't like it, but the one that feels triggered, that's behaving badly, because we're operating against our own true selves in that way and our own intention to be a loving partner, which what brought us together, whether it was an arranged marriage or whatever. Like, we had this intention to develop with each other and to be there for each other. So nobody likes it, right? Even though the nervous system doesn't immediately slow down or is not necessarily easy to interrupt, when we get that interruption and we help them get there, they're just like oh, somebody helped me do what I can't do for myself when I'm activated, right?
Mm-hmm. Yeah.
And of course, we're trying to help them do that, learn to do that, so they don't get so dysregulated.
Yeah, and
because they do have to take responsibility for that as well. But nobody likes it.
To be able to see through that presentation and see, like, this is just a person who's suffering, and bring that compassion, and which is probably what they're looking for. If we can do that as a therapist, it might be good modeling for what they can do for each other as well.
Yeah, it is, maybe not intended to be good modeling, but we do learn as adult humans by seeing what we've never seen before, and by, seeing new things. Like, that does help to have something to mimic. Just this one scene comes to my mind, a married couple recovering from an affair. And the wife got really triggered, and she stood up, and the man was still on the couch, and she stood up and she started, just reaming into him and saying bad words and calling him names. And it didn't last long, because my immediate reaction was to jump up and stop her. I can do that. I'm a large woman. I'm tall, probably taller than most men that come into my office, so I didn't have any hesitation I wasn't afraid. I guess I'm trying to say I wasn't at all. I knew what she was doing. She wasn't being mean to be mean. She was in so much pain. And I jumped up, and kind of put my hands up to stop her finger pointing. And she ended up grabbing my hand because I was right there. And then she just started to cry, right?
Yeah.
Just started to cry. And we sat back down, and her husband said, "Wow, I wish I could."
Mm-hmm.
Right? He's never been able to soothe her since the affair. And then he gets all flustered and withdraws anyway, right? Which was why the affair to begin with. So, but I didn't ever intend to be modeling for him, but it awakened something inside of him that he wanted to be able to do to calm her and comfort her.
Mm-hmm.
He saw beyond her distress as well, beyond her anger in that moment too. So yeah, we do model, even though that wasn't the intention. So thank you for all the amazing work that you're doing. I love the podcast. I love the group. I love the paid group. I just thank you so much for all you're doing to help couple therapists.
Oh, thank you so much. That's great. Yeah. And thank you. Anything, you want to mention your website or anything else that you have going on as we wrap up here?
Oh, sure. So drrebeccajorgensen.com or EFTcounseling.org are my two. You could find me on a bunch of other ones, but those are the two I'll throw out.
Yeah, great. Yeah, well, thank you so much. I always love talking to you and learning so much from you.
Thanks for the opportunity, Shane. So nice to see you.
Yeah. See you, Becca. Take care.